Welcome to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I'm your host, Brad Powell, Doctor of Physical Therapy. I'm the owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab, injury prevention, and overall health, bringing you expert insights from leaders across various healthcare fields. Please note, we will be aiming to provide you with the best knowledge and advice. The opinions shared here represent those of experts and are not to be a replacement from professional medical advice. So let's revolutionize healthcare together and make this happen. Today I have with me Stephan Olsen. He is an amazing CrossFit athlete here in the Salt Lake Valley. He's been doing CrossFit for 5 years now, and he's a coach at a local gym here. And I just love his philosophy towards CrossFit, what he brings to the healthcare community. And we're going to talk about some insights on how we gain trust and work together in the healthcare community. I bring some interesting insight. I've broken a lot of bones in the motocross community, and I've been a patient my whole life, and now I'm a healthcare provider. And Stephan brings some interesting insight because he's had a lot of good advice from healthcare professionals and a lot of very terrible advice. And we're going to talk about a few of those things today. So we'll kick it off. Stephan, tell us a few instances of just some not so good advice you've received from healthcare providers in the past.
Yeah, it's good to be here. You say revolution, we get fired up about it. But so I've been doing sports basically my whole life. Similar, I have not broken as many bones as you, but I've broken a few bones. Did sports in high school, and then some intramural stuff in college, and have just tried to stay generally active. Got introduced to CrossFit, and I'll tell you, like, the first comments that you get from CrossFit are like, "Oh, it's super dangerous. Watch out. Like, don't get involved in CrossFit," or like, "Those guys are crazy." And I understand where that comes from, but
tell us a little bit about that. Why do you think that is?
I think honestly, now that I'm kind of in CrossFit, it could be said about any sport, right? Like, football is nuts. You strap on pads and you run full speed and you hit each other as hard as you can. Like,
Sure.
That's crazy. Motocross is kind of crazy, right? Like you did. I think any fitness, that, like, you're using your body, you're out in space. And when you add this extra variable of maybe intensity that you're trying to do it at a higher level, or you want to improve or things like that, you're always going to bump into places where you're pushing your limits a little bit. And I think maybe CrossFit gets a bad rap because intensity is an intentional part of CrossFit, because that's where a lot of physical adaptations happen. But you have to be careful that you're not going to an intensity level that's beyond what your movement and your mechanics allow you to do. And so I think there's lots of videos of people doing just really stupid stuff with weight that's way too much.
Yeah. One of the things I hear a lot in the clinic, and just from different providers, is working with CrossFit athletes. They say, what a great retirement investment, like working
Yeah.
with CrossFit athletes. And I disagree with that. I love working with CrossFit athletes, but what I see in that world is a lot of that stigma comes from these athletes pushing themselves to the extremes and not listening to their body, and then going into injury. But then a lot of them have got really poor advice from healthcare providers, right? And then they just don't do anything about it, and they work through their injury. Tell me a little bit about that.
Yeah, well, I think that's right. Like, one thing I think is important to me, like, I don't do fitness just to do fitness. Like, I find enjoyment in it. And so it's fun to try and push myself. So one of the things that happened to me was, I try to push myself to do at least one CrossFit competition a year, where I find that I grow and do better. So I was trying to prepare myself for one last year, and had this, so I was lifting weights pretty heavy, and it was mostly when I was squatting that I would just get this intense pain in my back, and like couldn't lean forward. I felt like an old man, and couldn't figure out what it was. And there was a sports therapist that had gone to the gym in the past. The owner had a connection with him. And so I took that recommendation, went to him, and we did some, I'd say probably like more chiropractic related things, like the traction where it pulls on your back, and some various stretches and other things. And I think I went there twice a week for 3 months maybe. And the initial assessment was like, okay, let's just rest it. Like maybe you're just going too hard.
Yeah.
And I'm thinking to myself, yeah, that's possible. Like,
Let's be clear. Rest is one of the worst pieces of advice, right?
Yeah. I mean, he wasn't saying like, don't work out ever, but he was saying, don't do any deadlifts. Don't do any squats.
Kind of take a break from the heavy level.
Yeah.
Activity,
don't lift anything above 135 pounds, like not like really light. And that was, I was on board at the beginning. I'm like, okay, like let's
scale it back a little.
Yeah. Let's scale it back. It's not a bad idea. Let's try and figure this out. After going for 3 months, twice a week, I just felt like I wasn't making that much improvement. He'd said a couple of times like, all right, it seems like you're doing a little bit better. How about you try adding some more weight? And then I remember one day specifically, we had deadlifts in the workout. I got above 135 pounds for the first time in 2 months, maybe. And I think I went up to 185, which is not, shouldn't have been something that was super challenging for me. And felt okay in the workout. And then afterwards, it was just the same thing where I was just immobilized. I was in so much pain. And I went back to him and recounted the experience and how I felt, and told him that it was doing deadlifts, but I'd warmed up a ton. I'd done the exercises that he'd told me to go through. I'd kept it easy. I felt good in doing the movement. And his response was, oh yeah, deadlifts are just the worst. Like they're just not a good movement. That's just not a functional movement. And
what'd you think inside?
Yeah, we'll see. I feel lucky that I have, by this time I was a CrossFit coach, right? This is last year. I'd been coaching. I've been through the CrossFit level 1, and deadlift is a very critical, like hinging movements are one of the
I remember you told me one day, you were like,
movements.
Deadlift is life, man.
Yeah.
I need to find
and that's what I told
provider.
him. So I luckily had the confidence to kind of call him out on that. But I said, I don't, that you can't be serious, right? Like I deadlift maybe 100 times a day. I got 6 kids. I'm picking them up all the time. And
I tell people in our clinic, our clinicians all the time, if our patients, I don't care if they're 90 years old or 13 years old, if they have back pain and they're not graduating, you're teaching them, not teaching good mechanics. We've done it wrong to do a deadlift, right?
Yeah.
Everyone deadlifts. You think about just picking up a laundry basket off the floor.
Well,
right?
that was his retort, right? Was he's like, well, think about it. When you're picking up a kid, are you like deadlifting it? Or are you really doing more of a squat? He kind of gave this example of like getting in a full rigid squat position and sitting down and then picking something up like this.
Sense,
and I just looked at him and I said, I'm doing a deadlift every time, man. Or think about getting groceries out of your car, right? You can't squat down. Your trunk is at waist level. You can't squat down and pick your groceries up. You've got to be able to grab those groceries and hinge at your hips and pull them.
You can imagine how this advice for someone that didn't have the confidence like you. Tell me about like what you think. You see a lot of people in the gym. How would other people respond to the same sort of advice?
Yeah, I mean, I was devastated. I was like, are you kidding me? Like, like I said, I was lucky that I kind of had more confidence in movement in general. And I just thought there's no way that he could say like, just don't do deadlifts anymore. But I can't tell you the number of times as a coach that I've heard athletes tell me something like, oh, my doctor says I can't squat to parallel
again, right?
I can't squat to parallel. Or my shoulders, my arm, I just can't get my arms over my head. Or
and we got to be clear with those things. Sometimes they're important for a period of time, right?
For sure.
But a lot of the advice that we hear, and I hear in the gym as well, is my surgeon said, I can never do wall balls again.
Yeah.
Or I can never go past 90 again. And we're talking like 30-year-olds, right?
Yeah.
And you plant that in someone's mind, even just like the term, you have degenerative disc disease. I'm like, yeah, you and 50% of the population with no pain. You know what I mean? Like, but what that paints in people's head is I have a fragile knee or I have a fragile back and it's just glass. I literally can't do it. I have a bad back, right? The reason you have a bad back is because you don't know how to deadlift and you don't know how to progress into those loads and strengthen it, right?
Right. And unfortunately for a lot of people too, is they'll say like, oh, I've got a bad back, but then, maybe they get peer pressured into doing a deadlift and they instantly jump from nothing to like 225 pounds, right? And it's like, well, yeah, I'm not surprised you feel uncomfortable at that weight because you're blowing past your what you should be starting at to get the mechanics down
Yeah.
and get comfortable with it. So
And I love the philosophy in the CrossFit world. You learn the movement, you perfect the movement, and then you load the movement.
Yeah.
It's a 3-step process. What was kind of the mantra you were telling me?
Movement, mechanics, intensity. So get the movement, make sure you've got the mobility down right, then work on the mechanics of the movement itself, making sure your body's in the right position, you're aware in space, you're going to be safe, and then that's when you can start dialing up the intensity, whether it's doing it faster or adding more load, like more weight to it, more resistance to it, or doing it at a higher heart rate.
I mean, let's just briefly touch on the culture in the CrossFit world. I think it also gets a bad rap because people don't know how to have self-control, right?
Yeah.
I loved watching you the other day that a new gal came into the gym. She was like in her 40s, and she was worried about throwing extra weight on the bar. And you said, listen, there's no pressure to lift more. You're like, just do the bar. Like, let's work on learning the movement first. That's not the culture here in this gym. And I think a lot of gyms have the pressure of comparison. It's like, oh, Steven's doing 465 deadlift. I better, I'm almost as big as Steven. I better be lifting that much, right? But it's the culture that the coaches are setting that's really important.
Yeah. I mean, I think CrossFit kind of in its early days caught a foothold in with kind of like first responders, tactical, like lots of military, police, firefighters, who a lot of those people are they're inherently competitive, right? And an important part of physical adaptation is adding intensity or progressive overload or something where you are making it more challenging. Like that helps you grow, right? But when you add a little bit of competitive nature to it, sometimes that can push people to do things to feel a little peer pressure where they load the bar up a little too much, or they're doing something a little too fast and maybe don't have the mechanics down. So that is like this careful balance that you kind of have to play as a coach. And I think just in general, as like a person thinking about it, or even like a therapist, as you're teaching some of these mechanics, is like, I want you to be able to do this at intensity, but I want you to be proficient at this movement when you add that intensity, right?
Absolutely.
So like I think back to, I stopped going to that sports therapist. As soon as he said deadlifts are out, I kind of lost a lot of trust.
What great advice. Like if a provider tells you to stop doing a movement, let's just be clear. You need to find a new provider.
Yeah, I just couldn't.
There
couldn't
should be a different conversation, right? At least tell me the why.
Yeah.
Does the research support that? Does the research support you should never deadlift again? I'm not so sure, right? I have not seen one article.
Well, especially for something that's just so unavoidable, right?
Mm-hmm.
Like whether I do it with a barbell or with a kid or with groceries, or anything like that movement's just unavoidable.
Well,
Picking stuff up is unavoidable.
Earlier we were talking about DEXA scans, and Wolf's Law states you with a bone that you add a load to it over time and it changes the bone density, right? So you add load progressively over time. It's just a biomechanical principle that it changes the development, right? I was telling you, I got the DEXA scan. I started doing CrossFit in 3 months. My bone density almost doubled.
Yeah.
Right. And my bones got crazy strong just in that 3-month period. And it's just crazy how much if you add progressive load over time. My daughter, she's coming home and she's got calluses on her hands from doing the monkey bars. She's super obsessed with the monkey bars right now. And her friend, his name is Emerson as well. And she's got blisters and tearing.
Yeah.
And you think about this principle, she's like, I've been doing this for months. Right. And she's super proud of herself. And Emerson has only done it since the school started. Right. And that's why she's getting blisters. But that's the principle, right? You add progressive load over time, you master the movement, then you start to load the movement, you should see a great change. That's not for everyone, but for the majority of the population should respond that way.
Yeah. I mean, I think specifically there are people in our gym who some of them come in and they've got big egos and they want to lift heavy and they want to throw stuff around. And then I think of other people who have been really patient and they've gotten the movement and the mechanics down. And maybe that took a year to get down or even longer. But then you see that as soon as they can demonstrate proficiency in that movement and those mechanics, when they start adding intensity, their numbers go through the roof so fast, and they get to do it safely. They avoid injury. They can consistently show up and put a good effort forward.
Mm-hmm.
And that's like the coolest thing to see. So it was interesting to see when I ended up coming to Foundation Physical Therapy afterwards. I think the first thing you did was a movement analysis, and we walked through, and I remember doing some air squats, trying to figure this out, and you saying, "What'd you do to your ankle?" And I was like, "My ankle? I broke my ankle in high school. I haven't thought about it since high school, right?" But you were able to go through specific exercises to show me and demonstrate with me, "Hey, look, it's your ankle flexibility is limited on your left side, which is causing your hips to be slightly out of alignment, which when you squat, when you get into a deep squat, especially when you're heavy, and that's coming in on your back, that's putting a ton of pressure on your back." And so we walked through, and I remember being so instantly grateful for like the why behind it, especially because like I'm a coach. I walk through with other people how to do different types of movements, and I want to be able to point out those types of things of where like if they do feel like they're in pain or feeling discomfort or something, where we can look at some of the mechanics there. And so putting that why behind it and showing with, I mean, data, so to speak, of like literally my own body. It's like, It was clear. It's like, oh yes, this knee does not drive as far forward over my toes as my right side does. And so going through those exercises, and then we went through the therapy, and I mean, I've been squatting heavier in the last year than I've ever squatted in my life.
What did we spend, like 6, 7 sessions together?
Yeah, it wasn't much. But those exercises and empowering me to be able to do that and find that for myself was a huge difference maker that allowed me to basically jump right back into where I had been.
Yeah.
At the same weights that I'd been with the same volume.
Yeah.
But not having any pain anymore.
Yeah, let's kind of wrap this up and talk about tips. Like, what are things that are what advice would you give providers on talking to our CrossFit population? And I want to talk just briefly, give some advice to CrossFitters. You've been told, a lot of them, that deadlifting is bad. I can tell you it's not. If someone has told you that, that's completely wrong. Like, go find another provider, right? Wall balls, right? All those things are very good for your body. Movement is medicine. If people understood the value of movement, right, and exercise, it'd be the most highly prescribed medication in the world.
Yeah.
Right. But advocate for yourself. Like, make sure you advocate for yourself. Find a provider that will support your sport.
Yeah.
Rather than talk down on it.
I'd say, like, as a provider, what has become clear to me is it's not just about that person wanting to move because they feel like it's a necessity, like they have to do it to stay fit. Like, a lot of people get joy from movement. You know, like I get an immense amount of joy from doing the workouts that I do. So
Absolutely.
It's not just saying like, you're not just saying that like deadlift is unsafe for you or squatting is unsafe. You're actually like potentially taking away something that brings a lot of joy to that person. Yeah. And like, that's important to me. And so the idea of a provider telling me, hey, this movement is unsafe, or you're not going to be able to do that again, takes away the nuance of, I might have some joy or like some significant portion of myself that's tied to that, and I'd maybe rather just approach it from, rather than saying you shouldn't deadlift anymore, it should be more of like a, hey, let's get the appropriate intensity on your deadlifts so that you can continue to do them, but in a way that's going to increase your longevity over time and not derail you in the short term.
Let's rehab it while we stay in the gym.
Yeah.
You know, let's teach you how to modify. Let's work with your trainer to make sure we're not going into pain ranges, right? So it's about changing the squat a little bit temporarily so that we can get your end goals.
Yeah.
You know, I love the advice. Any other last piece of advice for our CrossFitters or for providers?
I think ultimately, like, just enabling people to move is great. And like, the goal is not protect someone from harm necessarily. Like, it's protect someone from harm, but within the parameters that they want to set. Like, I think the patient should be able to kind of set and dictate those parameters. And then the provider can say, great, I'm going to give you all the pieces that you can put together
Yeah.
to stay as safe as possible, but knowing that, like, I mean, life has some risk to it, but
Absolutely. I always tell a lot of patients, like, if you're not getting hurt in your routine, there's something wrong. You either you get heart disease, stroke, all these, comorbidities, or you have a sprained ankle every once in a while. Like, you're pushing your body, you're challenging your body, and just become 1% better every day. It's not about, some people have 5 injuries. And my advice to those people, when I graduated PT school, I had like 12 injuries. And I just thought, like, man, I really got to fix my own stuff if I'm going to preach this. And I remember going through each injury. It took me a year, but I fixed every single injury. And to this day, I have no pain. And I've broken over 30 bones, but just do 1% better. Focus on one injury at a time and get a good provider that can help you through those things and make it happen. And let's revolutionize healthcare. But thanks for joining us today, Stephan. We appreciate your expertise and what you do for our community.
yeah, likewise. Thanks, Brad.